The 340B program is a federal drug discount program that allows certain healthcare providers that serve a large number of low-income patients to get access to discounts on pharmaceuticals. It was created by Congress in 1992. The program is incredibly important for healthcare providers serving vulnerable patient populations because without these discounts, it would be very difficult for them to be able to stretch scarce resources and provide comprehensive services to patients who really need the help. There are some challenges going on with the 340B program. The drug industry is trying to reduce the number of drugs that are purchased through the program, largely by cutting back on access to the discounts in the contract pharmacy setting. So that would be the relationships that a patient or provider would have with a chain pharmacy or independent pharmacy or specialty pharmacy. 37 drug manufacturers have placed restrictions, and those are being hotly debated at the federal court level. Some have argued that the providers in the program, particularly hospitals, are not being transparent about how they're using the program, how they're using their savings. And so there's a lot of attention to that issue and some legislation that has been introduced to try to require providers to provide more details on the amount of savings they're getting through the program and how they're using the discounts. In 2018, the Trump administration tried to cut reimbursement to the hospitals in the 340B program, cut Medicare Part B reimbursement, which are the drugs used for like infusion care, cancer, etc. They cut the reimbursement quite significantly. The hospitals sued the government and the administration, and eventually the U.S. Supreme Court decided in favor of the hospitals, and now the government needs to reimburse the hospitals for significant losses in reimbursement. The hospitals are the ones that have faced the biggest hits, but also the covered entities like the community health centers, Ryan White clinics, they've also suffered a lot of losses because of the reductions in access to discounts in the contract pharmacy setting. It has helped the bottom lines of the drug industry, but it's not been particularly helpful for the ability to provide care to any patient regardless of ability to pay. And it's really been a struggle for those providers. I think the hospitals are going to have to agree to more transparency and more details about how they're utilizing the program and making sure that they're giving discounts to low-income patients. And then we're going to need to see the drug industry agree to basically start to provide the discounts again in the contract pharmacy setting. That would be what I think will be the ultimate solution.